Liang, how are you? Thank you for asking. I'm fine. But lately Grandpa keeps asking me if he has dementia. He wants me to take him to the doctor. Probably not. I was told by Dr. Zhen Ruixing, Director of Department of Neurology at Far Eastern Memorial Hospital, that patients with dementia are not aware of their condition. Grandpa can still get checked and set his mind at ease. If he really has dementia, how do I take care of him? Let's ask the Director of Department of Neurology, Dr. Zhen Ruixing, to explain. Dementia is a syndrome. Alzheimer's contribute to 60 to 70% of cases. Other forms include hydrocephalus, brain tumors, hypothyroidism, and vascular dementia. These can be prevented and treated depending on dementia type. The scariest form is Alzheimer's. We currently have not found a cure, so in terms of slowing progression, non-drug treatments are the main focus. We can reduce risk factors by 35% through preventative measures. We found that lifestyle changes can best help us manage and prevent dementia. There are 6 main approaches. Exercise the mind, keep active, eat healthy, strengthen social connections, good sleep hygiene, and reduce stress. These are the main ways to slow the progression of dementia. Liang, by helping Grandpa keep active and get regular exercise, you can strengthen and stimulate Grandpa's memory. This is very helpful. If Grandpa develops dementia, what should I do? Dr. Zhen is here to help. First, you need to learn how to care for a family elder with dementia and how to preserve the dignity of an elderly dementia patient. It's easy to say, but hard to do. So family members must learn how to care for a loved one with dementia. I found in many cases, the family can't care for the dementia patient because many of the patients have psychological symptoms. Statistically, about 30 to 40% of dementia patients suffer from delusions, hallucinations, and agitation and anxiety. It's quite common for patients to suspect their wife of cheating or stealing their belongings. In these situations, do not confront them directly, do not yell at them, change the topic and divert their attention. When you redirect them, you can keep them from repeating the same questions. Many of these behavior therapies must be learned. After much practice, you can better understand dementia patients and feel less frustrated when taking care of them. Oh, I see. Also, dementia patients often forget that they've already eaten and demand more food. What should I do? Do not argue with them. You can respond, "Okay, what would you like? I'll go prepare while you watch TV." Divert their attention to something interesting. Or plan for several small meals. Prepare smaller portions for each meal and provide foods that are more filling. This is the strategy: redirect, stall, and change. First, we try to redirect and divert their attention. Then we can use a stalling tactic to help them forget the issue. If they persist, we will need to change our approach and strategy, like planning for several small meals. Ah, I see. This is a human-oriented way to approach them. Dementia patients may have forgotten many things, but they're still capable of other things. We should guide them to explore life through their interests, their skills, their needs, and their abilities, and design daily activities accordingly. Here's an example. I met an elderly patient in his 70s with moderate dementia. He's very good at Chinese chess. Every time I visit him, I play with him and lose to him because he is really quite good. This is his skill. He's delighted after each match for a day or two afterward. This is one way to provide a happy, dignified life. When treating dementia patients, we need to design activities around their interests and take a human-oriented approach to the care of dementia patients. Learning their needs and interests, their past experiences, understanding their joys and sadness, only then can we design activities that help them achieve a happy life, a meaningful life, and a life with dignity. It's like caring for a child. Yes, it is similar. The entire home care environment is like that for a child. For example, medication and cleaning supplies should be placed out of reach. Regularly throw out expired foods, crackers, desiccant packs so they are not eaten by mistake. Other measures include shutting off the gas, decluttering walkways in the house, installing complex locks, and putting up wind chimes. Yes, I heard some dementia patients leave the house and can't find their way back. Yes, there are a few ways to minimize the risk of wandering, such as wearing an ID bracelet, having a cell phone or watch with GPS tracking, QR codes displayed on badges, or waterproof stickers to prevent the patient from going missing. Badges can be sewn on clothing or towels. The stickers can be affixed to canes, water bottles, cell phones, backpacks, or other belongings. Caring for dementia patients can be very difficult because they require comprehensive care in every detail of their lives. We need to understand their illness to help them regain their dignity and find joy and happiness. In addition, we can assist families to reclaim their lives. Foreign workers who have been unexplainably absent from work without contact for 3 consecutive days shall have their employment permit revoked, depart the country, and not be permitted to work again in the territory of the ROC. Foreign workers whose whereabouts are unclear, if engaged in illegal work, will be subject to a fine of 30,000 to 150,000 NT dollars. In other words, foreign workers whose whereabouts are unclear may be arrested and deported at any time and not permitted to return to the ROC for work.